do you need to be that effed up to benefit from the magic and the power of the rewiring of the brain that happens under the effects of psychedelics? Hey guys, welcome back to another edition of the Beyond Biohacking Brothers, where I'm joined as usual by my two brothers, Dr. Rudy and Miguel. And today we're going to go a little bit deeper. We're going to go beyond the veil, as they say. And, you know, forever since that we've started doing this, we've always considered us a clinic that treats the body, the mind, but also the spirit. And so, you know, we're great at treating the body and optimization and performance medicine. Whether you're a single mom or a performing athlete, we know what to do, and we know how to take you where you need to be. And a lot of the medications that we use in that realm will also optimize brain health, right? And obviously cognitive function. But there's a deeper side of it, a more spiritual side of it that we love, and that is in the realm of psychedelics. So we're going to talk about psychedelics today, and I think, you know, we all have very unique perspectives. We have shared philosophies and views on this. We just have different perspectives because we've had very different experiences while using psychedelics. For disclosure, we're not going to be talking about microdosing. We are the give me the dose kind of guys. And so we'll talk about the effects. You know, Dr. Rudy is a medical director at a ketamine clinic. So we'll talk about some of the different psychedelics available, you know, their use, some of the research on PTSD, depression, anxiety, and all of that. But also, like, the big reason we started to get into this from the optimization perspective, and you had a great question, the way that you posed it is, we know the research on depression, anxiety, PTSD, and all of that. But the question is, do you need to be that effed up to benefit from the magic and the power of the rewiring of the brain that happens under the effects of psychedelics? So maybe you can tell us a little bit about the experience that you've learned as you become a medical director of the ketamine, which is the only FDA-approved psychedelics.
Definitely. So this is a loaded subject because, again, our practice is a health, wellness, and longevity practice. But we also take care of body, mind, and spirit.
Yeah.
And we are experts of taking care of the physical body. You know, our 9 components of the wellness vortex includes nutrition, exercise, sleep, cardiovascular health, gut health, hormones, detox. That's 7. So somebody masters those 7 with us, you're going to feel pretty good physically. But is that all there is to it? So we added 2 dimensions to our wellness vortex. We added mindset, and then we added spirituality. And as an MD, it was always hard for me to even think that way because I didn't get trained that way. We get trained on only fixing the physical body. But as I started doing my functional medicine, my wellness practice, I started seeing that I get a lot of patients that I improve, optimize physically. They have a 6-pack, they look great, they feel great, but they are empty inside. They stay in the victimhood mentality. They have anxiety, depression, or sometimes you don't even need to have pathology. They have existential angst, or they can't get over some trauma that they went to. And despite everything that we do, you see that they are still held back.
Or just
what
apathy.
do you do? Or apathy, or lack of motivation. Testosterone works in the brain. If your thyroid is not good, we give you thyroid. It helps with cognitive function. So we work already on the brain function. But like, when I thought about what else can we do for spiritual optimization, how can we get people to connect with that greater energy that is out there and that has been proven to be healing? When they do studies about people who pray, you know, they do post-operative studies and they see people who pray, people who believe strongly, have better post-operative course, less pain medication use because they believe in a higher power. And it is no matter the religion. So there is something else. So what about the person who can't connect? What happens to that person? What can you do? And again, everything that we use are tools because the overall goal is self-actualization of your best self. So I see psychedelic as the cherry on top of the optimization. Once you've done everything and you see you can't get past that trauma that holds you back, Can we do something to help you? Of course, if you can do it with meditation, with psychotherapy, with breath work, with prayer, I'm 100% for it. But if you see you can't get there, there is a tool.
Which is very similar. We did a podcast some time ago about GOPs, which, nutrition, exercise, all of that. But if you still can't help it with that, then we can use a tool to help you get to that state. And so psychedelics play a role in the same sort of context there.
Completely. And let's start with the basics when it comes to psychedelics, because most people who are going to listen to this, psychedelics are a very charged conversation.
Yeah.
Because you think about the counterculture of the 1960s when psychedelics became, they took them away from us. So in the 1960s, the studies on psychedelics, what it was doing to addiction, curing addiction, for depression, anxiety, we had so many great studies, but then the countercultures, hippie culture came in, then Nixon put it away. It completely bended, and then it put every psychedelics as a Schedule I medication, meaning that it has absolutely no medical benefits and we cannot use it. Now there's been a psychedelic renaissance where over the past 20 years that we're seeing institutions like NYU, Imperial College of London, Johns Hopkins are doing studies. The first one they did was on psilocybin with cancer patients, terminally ill patients. And you see that there's an amazing video about it, a documentary, where you see patients confronting their mortality. And they have them do psychotherapy assisted with psilocybin. And you see those patients were able to accept their mortality and have a deeper understanding. I encourage everybody to see that. It is profound what it can do. And where I got with my journey of psychedelics, again, we'll talk about this. I've used psychedelics personally, and we're not here telling people to use psychedelics, to use something that is not FDA approved or something that is not legal. This is a personal decision. I went outside of the country to do my first psychedelic experience. So this is just all personal experiences. We're not recommending that to anybody. But what psychedelics can do to the person who's dealing with either anxiety, PTSD, depression, or existential angst is amazing. But Timothy Leary, which is one of the best minds on psychedelics, said something that I love. What about psychedelics for the betterment of well people? How amazing is this? Right.
And by the way, just to your point, because we're not saying go out there and shoot psychedelics, but if you are going to do it, we want you to listen to this, because there are practitioners, there's definitely doctors that can help you go through so that you can be supervised and do it correctly if you are going to do it. Right. And talk a little bit about the experiences. So I think the first one we should talk about, which I think, and for full disclosure, like yourself, we have practiced plant medicine. But yeah, actually, before we get to the first FDA approved for psychedelics, which you were a part of it, why don't you tell us a little bit about your personal story and how you got into psychedelics and why?
So first, let's go over the definition of psychedelic. What does it mean? So psychedelic comes from the Greek words, psyche, that means mind, and delios, that means revealing, manifesting.
Wow.
So psychedelics, it's mind revealing, mind manifesting. At one point, they changed the name to hallucinogens. They didn't like this name. Then they changed the name to entheogens. Entheogens means bringing you to God.
Yeah.
But psychedelics is what stopped. So there's different classes of psychedelics. There's the classical psychedelics, including LSD, psilocybin or magic mushroom, DMT, 5-MeO-DMT. Then you have the non-classical psychedelics, which are ketamine, MDMA, and mescaline. No, mescaline is a classical. So there's different classes. But that, at the end of the day, what do psychedelics do? Mind revealing. I'm going to talk first about the biological effects of psychedelics, because as a scientist, I needed to know that there was a neurobiology that correlates with the subjective feeling that we have. Yeah. Meaning that it's not just that, you take a trip, you see funny things, we're done. There was true neurobiological changes. So they've seen that psychedelics, mostly the classic psychedelics, they affect 5-HT2A receptors, the serotonin receptors, the same receptors that SSRI improved. Actually, the discovery of LSD in the 1950s was what prompted scientists to discover the serotonin system. Yeah. Because before LSD, we didn't even know there was anything going on in the brain. Wow. The first scientist who took LSD by accident had this, and he's like, there's something there. Then they went looking and they found the serotonin receptor because of LSD, and they developed the SSRI medication.
Wow, that's interesting.
Right? So look at what it brought to us.
Yeah, that's fun fact.
I don't stop reading.
My nerd.
SSRI came from psychedelics.
Yeah, well,
from
the
LSD.
discovery of the serotonin system came from that. Another thing that's important, and we just came back from RADFest, which is Revolution Against Aging and Death Conference. Yeah. This is all about longevity.
They are radical.
They are radical, and it's radical life extension.
Yeah.
The goal is to help humans live to 120 years within the next 10 to 20 years. I think we're going to get there. So I did a presentation there on psychedelics and longevity, because what's the use of living to 120 if you have poor mental health? If you're depressed, if you're anxious, you have no purpose. All your friends died. I don't want to live to 120 if it's this. So my point at the meeting was, we need that deeper connection. But more importantly, we need to maintain brain health. And what is the one molecule that we know helps maintain and grow brain health is BDNF, brain-derived neurotrophic factor. Actually, a lot of the peptides that we use as nootropics, think that they do to increase BDNF. Well, there's a study that recently came out that shows that psychedelics not only bind to the serotonin receptor, it binds also to the TrkB, which is the BDNF receptor. And it binds it almost 1,000 times stronger than anything else that we have so far.
Wow.
So BDNF is described as
brain-derived neurotrophic factor.
It is to help grow
neuroplasticity.
Neuroplasticity. So now we have a biological explanation of why psychedelics help. And the studies of psychedelics, so the first one that was FDA approved was S-ketamine. So they do it. Ketamine is an intravenous, intramuscular anesthetic agent that is the safest anesthetic to use because it doesn't stop your respiration. And they started doing studies. They see people who are receiving the dissociative anesthetic ketamine would have improvement of their mental health. So they started doing studies. They saw first that the IV ketamine was very efficient, but the FDA approved a different form of ketamine called S-ketamine, which is a nasal spray that's been FDA approved for anxiety, depression, and PTSD. So if somebody suffers from that, it's mostly for treatment-resistant depression, meaning that you have to fail 1 or 2 therapies, and then you can go with the nasal spray. At our clinic, TriStar Wellness, we use IV ketamine as an off-label use because S-ketamine is FDA approved, we can use that. So we use it for the same indications. And ketamine is a little different than the classic psychedelics. It's not really to the serotonin receptors. This is through the glutamate type receptor, which is something completely different. But at the end of the day, when they do functional MRIs, they're seeing the same things between the classic and non-classic psychedelics. So
wait, but what is it doing to the glutamate receptors? Is it inhibiting them?
So glutamate is it inhibits it because glutamate is very
excitatory. That's why.
So it works so differently than the classical. But they call that the phenomenology. The subjective feeling that you have is the same as people doing the other type of psychedelics.
That makes sense why it turns off your mind.
Yeah, and then let's talk about turning off your mind.
Yes, let's.
Because, and again, that came from the Imperial College of London, this scientist, Carl Harris. Amazing. He's done functional MRIs on multiple patients doing psilocybin. And he saw that there was a group of neurons that fired, they always say that neurons that fire together, wire together. He saw that there was a group of neurons that he called the default mode network. And that group of neurons, mostly in the cortex, the most advanced part of the brain, that was those neurons basically determine who you are. That's your ego, how you relate to the exterior world, your story about yourself. So, we form our ego. A child doesn't have a default mode network. A baby doesn't have that. A baby lives in the present. The more you live, you start
having a bank of memories.
A bank of memories.
And that bank of memories what creates those traumas.
Creates the default mode network. And then you wake up every day, you use mostly those same neurons to go through your regular day. So what they showed that when you take psychedelics is that you have a decreased blood flow to the default mode network and the desynchronization of those neurons. So basically you get ego dissolution or ego death. And then once that DMN doesn't communicate. It's almost like there was a short circuit.
Yeah.
And
Kind of like a scratch of the
short
CD
scratch
the
it.
pattern.
And then now another study showed functional MRI. Once you don't have the default mode network anymore, you have a hyperconnectivity of other areas of the brain. That's why now people start remembering things or hearing smells.
Or eureka moments.
Yeah, but even more than this, like there's something where some people can actually, they hear the music, but they can almost see the music.
Yeah, that happened to me, actually.
Yeah, the senses cross.
Yeah.
It's pretty amazing when you experience those kind of things, and it takes you out of your comfort level, and you see that, wow, there's such a different way of thinking. So the key to this is when you don't have the default mode network active, you have new parts of the brain connecting, you have neurons growing, neurogenesis, neuroplasticity. Neuroplasticity is the concept that the brain is an organ that can always change. And we use neuroplasticity with many different biohacking tools. Exercise increases neuroplasticity. Learning to play a musical instrument, learning a new language.
Anything that's awkward or new to the brain, you'll learn it.
It
expands those
the way that I like to
completely. Yeah. And we use all those as biohackers. We use all those tools.
Right.
Now there's a God-given molecule that can do this. Again, ketamine is synthetic, but all the other classic psychedelics, they're natural molecules. And it's been documented. I think the earliest use of psychedelic was documented 7,000 years ago in India. In Greece, they found places where they found that there were some psychedelic residues. When Socrates and all those big people were meeting, how do you think they were able to go so deep into philosophy, into religion? So we've lost.
Well, even in the pyramids, there's holograms that are found that relate to the experiences people see when they're under certain substances.
The sacred geometry.
Yeah.
So I'm glad that we're rediscovering something that we had lost because of the counterculture and because of the fear of addiction, which for some of them exists. Ketamine, there is a problem with addiction. Matthew Perry, the Friend store, died of ketamine addiction. Yeah. But when you look at it, it was so poorly done. Even the doctors, they were really taking advantage of it. At our clinic, we only do IV ketamine. We do it under supervision with the right setting for the right indications. So there's a way to do. Anything can be abused, but when used properly, it can
pre
be
and post integration, which is huge. It's kind of like, breaking the fast and after the fast for sure.
And we're great at those things. We know how to implement some kind of therapy. So for now, you look at the way MHI is using, we may tell patients if we see that they're dealing with something difficult, we may tell them, look, you go and talk to your psychiatrist, see if maybe they can prescribe either the S-ketamine or go do a ketamine. We don't do it ourselves. We may send patients there. Yeah. But for example, psilocybin is really undergoing breakthrough. It's been designated as a breakthrough medication in FDA. So we're hoping that within the next year or two, it's going to become FDA approved for psychotherapy-assisted psychedelics because it can really help with PTSD, anxiety, depression. So I can't wait to have this as a tool.
But I'd like to talk about ketamine, like you said, about turning off the mind. Because again, going back to the subject of, do you need to have all those things to benefit? And the answer is loudly no. Now, I'm going to just talk subjectively, and you can kind of fact check me, as a doctor. But like when Miguel and I got into this through you, we were more interested on, again, we don't have depression or anxiety or any of those things. At least I don't. And but I was like the word neuroplasticity kept coming up on the research. Yeah. And I really wanted to dive deep into that word. And what does that really mean? And does that mean that I'm going to be smarter after I wake up? Because I need all the neurons I can get, right? So like when we started to look at neuroplasticity, I was like, okay, that's what I'm really interested in. And we went under and I did 6 sessions, right? Every session was beneficial. Every session was different. Did I feel like I got any smarter right after the sessions? I would say no, but I will say that when I look at my life years after, doing psychedelics, and I always do it under a correct setting with supervision for the right purpose, right? And it's not like I'm doing it every weekend, guys. This is not a medication that like for it doesn't have a highly addictive sort of association to it.
Yeah. But ketamine does if you use it.
I could, but I'm saying like I don't, my sessions have been very sporadic throughout the years, but I can definitely see like the way that I like to think about neuroplasticity, and I've discussed this with you, I feel like the use of psychedelics have definitely expanded the real estate of my brain. Like I'm allowed now to see further, deeper, bigger, step back from my life, look at my life from different directions and different perspectives that I had not been able to look at before because I had not done psychedelics. And when you're in psychedelics, it's the only way. And again, if you can get there through meditation, amazing. But for me, like going into a psychedelic session, like it allowed me to look deeply into who I was, what I was here for. And talking about the turning off of the mind, like if you're, even you don't have to be a CEO, you don't have to be a Fortune 500, manager of a company, but we all run our lives. And like you said, the default network, like we're almost slaves to this thing. We're most of us are living our lives on autopilot. And even if you're conscious about it, there is a portion of your life that you live on autopilot. We all do it, right? So, and because we live in such an interconnected, highly technological world, you could go on a vacation to Fiji, but if you take your phone, forget it. Yeah. You're not going to get disconnected. And even if you don't take your phone, what is your monkey brain going to do? Oh my God, I have a meeting. Oh my God, my surgery. Oh my God, no, job. I wonder how the business is doing. I wonder how my dad's doing. Like, you do all that. But what I found with ketamine, it's like, you have no choice. You are going to get disconnected from this reality and you're going to be in a completely different one. And you are not going to be thinking about any of those things. Yeah. So that's where the shutting off the mind comes and you can step back, life pauses, and you're now in this other realm that you're able to look at yourself, your existence, the world in a completely different place. And for me, it was getting reconnected to my purpose.
Yeah.
Is that fair?
That is more than fair. And I think that is the most important thing with psychedelic. You said something really important. It changes your perspective.
Yeah.
Because I love to say that we have a reductive way of thinking. Humans like to reduce everything to their smallest, most simplest way of understanding. Yeah. So we are this human body. We look at ourselves. That's who we are, that little box. That's it. Mm-hmm. Imagine spending your life thinking that's all you are. We are so much more than that. Yeah. So that perspective, most people who do psychedelics will feel that. They'll tell you they have what is called a mystical experience. Yeah. The mystical experience has nothing to do with the mystical, magical, or anything like this. A mystical experience means that you've experienced oneness. You've experienced being connected, the interrelatedness and interconnectedness of all things. What do every book, including the Bible, tries to say? We all the same. There's spirit in everything. It's easy to say that or to try to understand that intellectually, but if you actually experience it, there's nothing like it. Yeah. So every time when we do our experience, everybody's different. Yeah. But when you distill it to almost everybody,
it has these common denominators.
That common denominator. Yeah. I feel like I was one with the universe. I saw myself from another
connected
place.
To source.
Connected to God, to source. Some people see Jesus. Yeah. Some people see Gandhi. Some people see, it's whatever in your culture. Yeah. But at the end of the day, when you distill it, it's this. And what is that energy? Love.
Yeah.
Capital L. Love.
Yeah.
And then if you connect to that big energy, by whichever way, good things usually happen.
And by the way, I still remember my first experience, and one of the things that I learned there, it was a reminder that the shit that we worry about is so petty.
Small.
It's so petty when
so what do I say? Big up yourself.
When we look at when we look at life from a complete, from God's perspective or from a 1,000,000 foot view, it's so petty, but that doesn't mean that I came back, sold my possessions, and became a beach hippie. Like, I still came.
Still like the physical.
Yeah, I still came back to my life, but it changed the definition of why I did things.
And you'll see most people who do plant medicine or psychedelics, their language is different. They say, I love you so much easier.
For sure.
They're more connected to the planet. They're so much more tolerant. Yeah. So you can see, like I love the word namaste in Hindi. Namaste, because it says, the light in me recognizes the light in you. And you know what? People who've done this, people who are connected, you recognize it. I say I love you now so much easier. Yeah. I say I'm connected so much easier because I have
Which is rare for a scientist and a doctor, right?
Yeah.
It's how Abraham Hicks says, tapped in, turned on, tuned in.
Completely, man.
Yeah. So and I think, I think let's discuss a little bit like the element of death, right? Because I think that's super important. Like we're so tied to our lives, and we're so scared of death. But this weekend you came up with a great quote. What is it like?
So
can you say it, please?
Beautiful. Because so first, let's talk about death.
Yeah.
So near-death experience have been something that they've studied forever. Do you guys remember seeing that movie Flatliners?
No.
Oh, yeah, it was medical students who were making themselves go flatline, their brain to stop so they can experience going through the white light.
Oh, wow.
So, is this real?
No, it was a movie. Actually, they're remaking the movie, but I saw that there. It was a long time ago.
Okay.
But they've studied near-death experience, and that's the closest thing to the psychedelic mystical experience. When I had my first psychedelic experience, I went through the light.
Yeah.
I saw the white light, and it felt ecstatic.
Yeah.
And they see that it's the same areas of the brain that light up when you have an ND, near-death experience, or a psychedelic experience. So at the conference on the longevity, that's what I said. I said, first, we need to look at death from a different perspective. Yes, I want to live until I'm 120, 150. Yeah. I want to prolong my life. I would love life. I love this physical world.
Yeah.
I love food. I love my wife. I love my kids. Yeah. I love seeing the sunset. I love the physical world. But at the same time, we need to realize this is not all it is. Yeah. And what psychedelics can help you is lose the fear of death. Yeah. That's one thing that's common to humans.
That there is
doesn't
no
mean that
death.
you're going to jump off an airplane without a parachute.
That you experience that there is no death, that there is something beyond.
So the quote that was actually found on the door at a monastery in Greece, St. Paul's Monastery, it says, if you die before you die, then you won't die when you die. What it means that...
Say it again. You got to say it again.
You die before you die. So die means ego death.
Yes.
So if you experience
kill your
death
ego,
before you die,
yes.
so you realize you're much bigger than human body.
Yeah.
You won't die when you actually physically die, because you won't have
that
fear.
Yeah.
How beautiful is that? That was 1,000 plus years
ago. If you die
ago.
before you die, you won't die when you die.
And there are psychedelics.
St. Paul's Monastery in Greece.
That's what it said?
Yeah.
Interesting.
How interesting is this?
Lovely.
So how are we not talking about death differently?
Yeah.
So what's his name again? Brian Johnson, who's the guy who's doing all that anti-aging. I read an article that he did on that subject, and he kind of did a twist to that. He said, yeah, I really like that. I still don't want to die. So he says, die before you don't die.
Well, he's probably
Did
never
you hear
really
that?
had a psychedelic experience that's
No,
taken
but
him
listen to
further
what he said.
than
No,
that.
he said that. He said psychedelics are his best teachers.
Oh, he did?
Yeah,
So
he has a
does
great
psychedelic.
article.
Okay.
But the way he put it, I love it. He says, die before you don't die. So experience death, ego death, but then fight everything not to die.
Before you don't die.
Yeah. Beautiful.
Right.
Right? So when we look at psychedelics from that perspective of helping us deal with the common human problem of the fear of death, existential angst, that's the betterment of well people. Then you go into anxiety, depression, PTSD, suicidal rates. Yeah. Look at all the benefits that this can bring. Then you think about the neuroplasticity. I showed a picture of functional MRIs where it shows you a nerve cell after ketamine infusion, and you see the little dendritic growth that's growing, almost the mycelium,
the dendritic synaptic firing
of fungi that are just growing. And that's what you want your brain. You want more connection. It's like a supercomputer. Yeah. So if I'm growing my muscle, don't I want to grow my brain cells also?
Right.
Am I only going to grow my muscles when I'm 110? I'm a big muscle guy, but my brain is dead.
Six-pack mentally. And most people, they try to have a six-pack physically, one-pack mentally, and a zero-pack spiritually. Yes. So literally flip it over. Six-pack spiritually.
I want a six-pack everywhere, man.
6 packs times 3.
I like that's a new one. 6-pack times 3.
Yeah.
6x3.
Yeah. So again, I think we've gone deep.
Yeah, we've gone deeper. And look, we can do another one and talk about the different classes and what they do and all that. I think this was just a general sense to let you know that there is a way. If you're a great meditator, we support that. If you're a great prayer, we support that. And it's just whatever gets you so that you can go beyond the veil, so that you can look at life from a different perspective and know that there's something beyond this world that we are all here purposed for. And so our job is always to, like you said, we're very good at treating the body, and we've had patients for years that, they've crushed it in their life, they've crushed it in their business, they've crushed it physically, they have great relationships, and they kind of just lose that edge, right? And it's like, okay, let me now take that and make you a soldier for the light. Let me show you the other side of the veil so that you can use all of that and be a weapon for good, right? Because God knows we need that. And so, if you've ever thought about psychedelics, we're happy to teach you about them. Again, we're not encouraging or direct you to the right place so that you do it properly, so that you have the right experience, so that you're managed and treated by the right professional staff, so that this can be a beneficial thing for you, whether it's for a pathology or whether it's for you to dig deeper into an area of yourself that you never imagined you even had.
So one quote that I heard that I love is, when you do this type of work, it can take you from victimhood to godhood.
Yeah, baby.
From victimhood to godhood.
Yeah.
And what's my name, guys? The white coat shaman.
Yes, you are.
Now, when I use psychedelics, I still have my white coat, and I'm in conventional medicine. I'm going to treat your body.
Yeah.
But then I put my shaman hat, and then I'm like, let's treat your spirit.
Let's treat your
So
spirit.
we can optimize mind, body,
Let's
and
heal the
spirit.
spirit. So if you have any questions, of course, we're here for you. This is not specifically in the realm of what we do, but definitely we'll answer the questions if you have any and you want to be pointing in the right direction. So until then, God bless.
Follow, and share.
Like, follow, and share. Till then, stay healthy. God bless.